Do I need a second opinion for my breast cancer diagnosis? Let me share some important thoughts on this subject. The question often arises with the diagnosis of breast cancer, or for that matter, any cancer, do I need a second opinion? And the answer to that question is a qualified perhaps. The perhaps is, it depends on where you've been diagnosed, the team of people that you're working with, the confidence and experience that you have in the people that you're working with, and most importantly, is it a multidisciplinary process? Now, if you've been recently diagnosed at a NCI stands for National Cancer Institute, Comprehensive Cancer Center, then far more likely than not, you do not need a second opinion. Such centers, of which there are approximately 80 in the United States, 80 some, are usually university-based centers like here in California, UCLA, UCSF, UC San Diego, etc. There they are organized in a multidisciplinary approach with extremely high levels of expertise in all of the areas that you need to be diagnosed in. That includes radiology, pathology, surgery, medical oncology, and radiation oncology. So if you've been diagnosed at that level, far more likely than not, you don't need a second opinion. However, if you've been diagnosed out in the community setting, where 85% of all cancer care occurs in the United States, then in fact you may need a second opinion depending on the experience of the surgeon and radiologists and medical oncologists and the team of people that you're dealing with. You will need to ask a very important question. Are you, Dr. So-and-so, part of a multidisciplinary team here at St. Elsewhere Hospital? If the answer is yes, then likely you may not need a second opinion. But even within that setting, there may be certain providers that you may not be fully comfortable with and in fact may want a second opinion, let's say as an example from another surgeon among the team of people who are caring for you. The same could be true of the medical oncologists and others. So the key question here is, am I in a multidisciplinary process? Do I have an experienced team of people taking care of me? Or should I seek opinions and levels of care elsewhere? These are the key points to helping you answer this vitally important question. Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.